Today I'd like to share a case of Flexor Tenosynovitis and how bedside ultrasound helped us make the diagnosis. So the story is a young right-hand dominant woman who came in with left index finger pain and swelling times 3 weeks after getting bitten and scratched multiple times by her cat. Now this is not her cat, but this is actually a picture of her hands. And you can see here all the multiple cat bites and scratches on both hands, and this finger here, her left index finger, was the one that was most painful. So of course I was worried about a serious infection here, and here is a close-up of her finger that she was complaining about, and you can see that it was flexed here. She actually could not straighten it out. You can see these puncture marks and actually a little bit of pus underneath the skin here. And here's just another view of her finger on the ulnar aspect. So when we talk about diagnosing Flexor Tenosynovitis, it's primarily a clinical diagnosis, but this smart man, Dr. KANAVEL, he gave us some cardinal signs to look for all the way back from 1933. And the cardinal signs are, number one, a partially flexed finger at rest. This is what the patient had. Number two, symmetric enlargement, also known as the sausage digit. She also had this. Number three, tenderness along the course of the flexor tendon sheath. Also had this on exam. And number four, pain with passive extension, which can be the earliest and most reliable sign when trying to diagnose Flexor Tenosynovitis. However, there are no great studies validating the sensitivity and specificity, and not all patients with deep space flexor tendon sheath infection will have all of these signs. And there was a small study that looked at 41 patients with a diagnosis of Flexor Tenosynovitis, and only 54% had all four signs. So are there other ways that, for example, ultrasound can help us with this diagnosis? And back in 2009, there was a case report in the Journal of the Society for Academic Emergency Medicine describing how ultrasound can be KANAVEL'S fifth sign. And here you're seeing that the patient's hand is in a water bath, which is a great way to do ultrasound on very shallow structures, especially the hand, or you can have a really large gel bridge in between the probe and the finger. But here, a water bath works great. And so I ultrasounded the patient's finger that she was complaining of, and this is the flexor tendon here in the middle of the screen in the longitudinal view, and you can see all this edema and cellulitis in the soft tissues of her finger, but more importantly, her flexor tendon is completely surrounded by fluid. Here is another view, a little bit more distal on her finger, and the surrounding edema completely extends distal on her finger all the way around. So I did a transverse view, and here you can see really well that the entire tendon is completely surrounded with fluid. So the entire tendon is inflamed with edema, but on exam her finger was also fluctuant, and this is where most of the fluid is around here. The question was this just a simple finger abscess or Flexor Tenosynovitis? And this really helped us nail the diagnosis. So unfortunately, the patient actually ended up signing out AMA, but not before she had a bedside IND by our hand specialists, got some IV antibiotics, and was sent home on PO antibiotics, and she just followed up as an outpatient. So some take-home points from this case. Number one, KANAVEL signs are great, but they are not perfect. Your bedside ultrasound can act as a fifth KANAVEL sign and can really help you narrow down your differential diagnosis. And when you're doing an ultrasound on shallow structures, especially the hand, consider using a water bath to take a look and to get better pictures. Please visit our website. If you have any questions, please feel free to email any of us. Thank you.